Okay, now we're going to continue with Chapter 43, Part 2, Bleeding Disorders. First, I'm going to talk about hemophilia. It refers to a group of hereditary bleeding disorders from a deficiency in the specific clotting factors. It's an X-linked recessive trait. Genes for clotting factors 8 and 9 are on the X chromosomes. The mother is the carrier and has a 50% chance of transmitting disease to her sons. A third of the cases have no family history and are a new mutation. In 80% of cases, hemophilia is X-linked, affects males only, females are the carriers. So why? Well, because the trait's carried on the X chromosome. Females have 2 X chromosomes, males only have 1. So if they get the bad chromosome, yes, they're going to have hemophilia. If the females get the bad chromosome, they just become a carrier. So do the Punnett square again. So you go XX, YX, or XX, YX. Disease occurs in males. Females become the carriers. That's just a reminder. Female carriers usually do not manifest symptoms of disease. They may have prolonged bleeding during dental work or surgery. Okay, let's look at the most common types. We have hemophilia A. It's a classic hemophilia. Accounts for 80% of the cases. It's a deficiency in factor 8. Then we have hemophilia B, also known as Christmas disease. It's caused by deficiency of factor 9. And then, of course, we have the von Willebrand disease. This is deficiency of von Willebrand factor and factor 8. It affects both males and females. Looking at diagnosis and manifestations, diagnosis is made based on a history of bleeding episodes and blatant prolonged bleeding. It's confirmed with DNA testing. Laboratory findings, there will be low levels of factor 8 or 9 or prolonged partial thromboblastin time, PTT. So clinical manifestations can include mild to severe bleeding tendencies. They can be asymptomatic until about 6 months of age when increased mobility and minor trauma may occur. May be suspected in newborns who have excessive bleeding after circumcision. There is hemarthrosis, that's bleeding into joint spaces. We have pain, we could have tenderness, decreased range of motion. They could bruise easily. There could be nosebleeds. Hematuria. Look at box 43-5 on page 1376 of your textbook. Okay, now let's cover the treatment and management. There is an aggressive replacement therapy with missing clotting factors. They may have a home infusion of the missing factors. These kids have a near normal life expectancy with treatment. There is DDAVP, desmopressin. It's an analog of vasopressin. DDAVP stimulates the release of factor 8, which is stored in the blood vessels, which increases the amount of factor 8 available by 2 to 4 times. It will be, of course, IV administration or nasal spray. It causes 2 to 4 times the increase in the factor 8 activity, as previously discussed, and is used for mild hemophilia. There is also aminocaproic acid, prevents the clot destruction. Gene therapy involves introducing a working copy of the factor 8 into a patient with a flawed copy of the gene. There are still problems with this and hence no cure yet. The goal of management is to prevent bleeding. However, if a kid is bleeding, hold pressure for 15 minutes. So for supportive care, encourage them to use soft toothbrushes, padded bed rails, soft toys, bike helmets. Teach the parents signs of bleeding into the joints, how to manage bleeding, medication teaching, and then teach prevention of injuries. Child may have developmental delay due to the physical activity restrictions. You want to encourage parents to get child involved in appropriate physical activities. Remember RICE, rest, ice, compression, elevation. Parents should have cold packs in the freezer ready to go in case of injury. Prevention of crippling effects of bleeding. When blood collects in the joints, it can cause immobilization. So after the bleeding has subsided, range of motion exercises are important. Aspiration of blood from within the joint space may be necessary. Physical therapy may be needed or an orthopedic consult. Be supportive of the parents, especially the mother. Moms usually blame themselves for this, and husbands can blame their wives too. So be very sympathetic or empathetic. Boards questioned: what would be a good sport activity for a child with hemophilia? Karate? Football? No, you really don't want contact sports. How about swimming or chess? Okay, now I want to talk about idiopathic thrombocytopenic purpura, ITP, also known as immune thrombocytopenia. ITP is an acquired hemorrhagic disorder characterized by thrombocytopenia, which is excessive destruction of the platelets, and purpura, which is the discoloration caused by petechiae beneath the skin. Normal bone marrow with normal or increased number of immature platelets or eosinophils are a sign. Although bone marrow production of platelets is normal, but the spleen ends up destroying the platelets. When destruction exceeds the production, platelet count decreases and bleeding occurs, hence the purple coloring. Most common bleeding disorder in children, it peaks between the ages of 2 to 5 years. It's acute and self-limiting, often follows up a respiratory or other infection like measles, rubella, or chickenpox, or after parvovirus B19, which is also known as fist disease. It becomes chronic if it lasts longer than 12 months duration. So some of the clinical manifestations can include multiple bruises, petechiae, purpura, bleeding from the gums or the nose, blood in the urine or the stool. Look at box 43-6 on page 1378 of your textbook. Treatment's going to consist of corticosteroids, intravenous immunoglobulins such as IVIG or anti-RHD. Look at box 43-7 and the nursing alert on page 1378 of your textbook. If there is no response to medication after 6 months to a year, a splenectomy is performed. Children are put on an activity restriction so that they don't hemorrhage with any injuries. Give steroids because it can raise the platelet count by suppressing the immune system. They don't usually give platelets because if they do give them, the spleen will just destroy them anyway, so it's basically a waste. This concludes Chapter 43, Part 2.